Greetings, everyone. Welcome to another episode of The Professionals You Should Know. This show is about uncovering the journeys of professionals from different industries. And today, we have the compassionate and resourceful Braveheart Enwaraji, who is a physician associate. Thank you for joining us. It's a pleasure to have you here.
My pleasure. Thank you for bringing me here.
Anytime. So, what is it that you do?
So I'm a physician associate. Have you heard about this profession?
No, I've heard about it, but I've never understood what they do. So,
Oh, of course, it's totally understandable. So
Yeah.
we are essentially medical associate professionals,
right.
which is the umbrella term that falls under our own category alongside other allied professionals like advanced clinical practitioners. We have
Okay.
also anesthetic associates.
Right.
What we do, we are journalists, medicine, so
Right.
we are
Okay.
trained in the medical way. We work alongside doctors, consultants, and then we are capable of seeing patients, taking history, interpretation of investigation, making management plans. Also, all this under the supervision of a consultant or a senior doctor.
Okay. So, what is your like a day to day look like for you?
So, well, I work in hospital.
Okay.
There are a variety of options you can do in this profession. You can work in GP, or you can work in hospital or in community care. In my case, I work in acute medicine.
Okay.
And then most of my day-to-day tasks are seeing acutely unwell patients that are being
Right.
transferred from emergency department onto our care, which are the medical team. And then
Right.
I'm involved as part of the multidisciplinary team, which
Yeah.
involves doctor, nurses, physiotherapists, in all united in the looking after patient. I'll be responsible of X number of people, ensuring that the plan that being provided by the consultant is fully completed,
Right.
and liaising with the family and having difficult conversation whenever they're like very unwell, sick patient.
Okay. So you said under the supervision of like a consultant
Yeah.
or GP.
Yeah.
So what does that look like then? So yeah, explain that.
Yeah, of course. So being a newly introduced profession
Right.
in the UK, I will start from
Yeah.
the beginning actually, so it
Right.
will make more sense. So the role was actually introduced by the United States.
Oh.
This was, I may be wrong, but I believe after the Vietnamese War, where there was shortage of doctors in the field, so they would then go and train some of the military professionals to get into the medicine just to sustain. Seeing that had worked, they then introduced in their own healthcare system, and then over the past decades, they've been a very established profession. In the United Kingdom, we were introduced in early 2000, maybe 2003. This because we were meant to be, actually, we are professional meant to be support doctors and NHS itself. But being a qualification that it is done after 2 years of a postgraduate degree, obviously it may be quite doubtful for some people to understand,
Yeah.
oh, this profession has really short term of training, which is still intense, but they do require supervision. So we need to have a senior
Right.
consultant that ensure that whatever we're doing is within the profession limits. So we have
Okay.
abilities and certain limitation, which involves not being capable of prescribing or ordering ionizing radiation,
Right. Okay.
and also to
Okay.
ensure that the patient safety is made on the place on the first place.
Okay. So why physician associate? What made you become a physician associate? What's your journey?
You won't believe me, Ryan. I was actually a sports therapist before becoming a physician associate.
Okay.
Yeah, that was back in. So I started a course in 2016
Yeah.
at London Metropolitan University, and at the time I was doing, as I was going along my years of my degree, my first degree as sports therapy. I wanted to have a more of a pivotal or an important role in patient care, not knowing where or what I wanted to do. I was kind of difficult to either become into the medical sector or becoming more of a cardiac physiologist.
Okay.
Yeah, then my physiology lecturer introduced me to the role, and then I was like, wow, this sounds very, very cool.
Yeah.
And then being involved in the care and then play an important role in clinical decision was one of the key things that made me want to become a physician associate. And I think it's a very, very good profession.
So how does it work? Do you have to have a post? Do you have to do undergrad first, and then you have to do get an MSc, a postgrad?
Yeah, so you need to have a science-related degree.
Okay.
For becoming a physician associate or joining the degree itself.
Okay.
Now there are a lot of universities that are welcoming this course. It's becoming more and more competitive because the higher number of application. So your degree has to relate at least something related to science, which could be you can have done biomedical science, physiotherapy, may have been a nursing in your past. And then you do these 2 intense years. I want to emphasize.
Really? Yeah, you did that.
Because it's a back-to-back, really. In your first year, you are learning the core foundation of medicine, which involves anatomy, physiology, pharmacology as well. And alongside this, you're once weekly. I speak on behalf of my own past university. You then do once weekly rotation or placement in a GP practice.
Really?
Yeah.
So you're doing the theory side, and then once a week you're in a GP practice.
Exactly. Yeah, and that's 2 months into the course. So
yeah.
And then your second year, then you're then introduced into the hospital field, where we'll be going into acute medicine, cardiology, respiratory, pediatrics.
Pediatrics as well.
Yes. Yeah.
Wow. So you go through all the kind of core components of medicine in a sense.
Yeah. Because the main purpose of our role, we are journalists. When we are not meant to be specialized in a specific sector.
Right.
We have to make sure that our knowledge is broadened, and then we are capable of diagnosing, managing the most common presentation, depending on which branch of medicine this falls into.
Okay. And when you said so, for example, like for scans and investigations, can you recommend it, or would that be only down to like the GPs?
So I will speak from the hospital, then I'll go to the GP.
Right.
So in my own experience in my current job, if a patient requires a urgent imaging, like a chest X-ray or a CT scan. Obviously, this might have to come from the consultant plan.
Right.
If you find yourself in A&E, where you are the first line person the patient is seeing, you make a plan, and then you discuss one of the seniors, and then in agreement, then they would then request on your behalf.
Right.
And the reason why we haven't had the right to ionize radiation alongside prescribing is because we don't have a statutory regulation and legislation that covers the pharmacological side of it.
I see. So theoretically you could, but legally you can't.
No.
I see.
But that does not mean that you don't know what you're doing. You understand if someone's coming, with breathing well with a very nasty cough. You suspect possibly this person might have a chest infection. And that falls into your clinical knowledge, and you know that a chest X-ray is warranted in this situation. And if it is reasonable, I wouldn't see why not the senior doctor approve it and get that done for you.
Okay. So what is like some of the miscommunications? So what are some of the misconceptions about the role?
Well, it's a tough one. I think most of the misconception that has been coming over the past years is the idea that the role is to replace doctors, which is not the case. And then I would really want to emphasize that we are all members of a medical profession and working a part of a multidisciplinary team, and then we all work alongside in order to focus on the care of a person, of a patient. However, there are doubts, there are hesitation about the role, which is quite normal thing. Whenever something new gets introduced, there will be a lot of questions at the beginning. But as years goes by, and then it found to be a successful idea, then those questions are not more brought up, isn't it? So I assume even when it was introduced back in the States, there were many people questioning why do we have this profession coming in. But I think people need to be more confident that we are here to help and support people. And also looking at how the situation in NHS is currently, facing with a very shortage of staff.
Yeah.
Most nurses are now leaving.
Yeah.
We have,
read that,
I think,
read
as of this year, according to the Guardian publishment back in June, July,
Mm.
there were 10,500 vacancies of doctor roles. So
Okay.
that's why we are part of the long-term NHS plan in order to help sustain NHS alongside the doctors.
Mm.
However, I'm afraid that as I said, as part of this fear, they think that, in having us around, we're kind of slowing down the system, or financially being a more of a reasonable option of a doctor when it comes to expenses. But it's just part of time as people get adjusted, not just from my professional side in terms of colleagues, but also for the patient to understand, oh wow, this is a profession is helping us. It's not actually taking just one other person. So yeah. And then I also look after both adults and elderly patients. So it's a mixture of the two.
Okay.
And I think in this specific branch of medicine, you're well exposed to multiple types of condition. So you observed a lot of learning and a lot of information, and which goes and broaden your knowledge as well. In GP, yes, you do see acute presentation, but it's mostly chronic condition that comes into the GP. In future, who knows, I might be heading back to GP when I feel like, I might want to settle down with family. And I want more of a much of a stable, flexible lifestyle.
Okay.
But as of for now, I think acute medicine is my way, and then I'll see if perhaps I pick a particular interest in a specific field. I might just join that specific field, which can be cardiology, respiratory, or rheumatology. However, that doesn't make me a specialist in that field. It will just make me, I will be hired in that field, but I can't say I'm a physician associate or cardiology physician associate.
Right, because you're general anyway.
I'm always general. You get assessed every 6 years.
Oh, is it?
Yeah. So every 6 years we need to do an examination to ensure that our general knowledge is still there. Because that's the main reason why we're introduced in the first place. Yeah.
Oh, I didn't know that. So you have to be great. You have to be assessed every single 6 year, every 6 years.
Yeah. So
to check if you're still qualified.
Yeah. I think it's a reasonable choice. However, others can have a different opinion. But it's good to ensure that your knowledge is still there.
Yeah.
So that you are flexible to move for a certain specialty to another. And then this involves either going to Liverpool attending like a test, which can be 100 questions or 200 if things haven't changed. And then obviously if you fail the test, I think if you fail twice, obviously you may not be allowed to regain that profession again. So I think that's why it's very important that as the 6 years from the moment you start working, you ensure that your knowledge is still there in every aspect of general medicine. Yeah, it's tough.
It's tough.
Yeah, it is indeed. But even the doctors, however, where doctors, get into the medical school, they do 6 years of training, they do 2 years of foundation training, and then they tend to have to specialize in a specific branch of medicine. So they get tested all this time. So it's a similar thing for us. We need to make sure that your knowledge is still there, that that you're still safe to practice and looking after people. It's a good thing for the patient perspective.
Of course. So who do you feel appreciates you the most? It could be patients, government, colleagues. Who do you feel that appreciates?
I think despite all the past recent negative press we have had, is not the reflection of what we actually experience in the field. We have, and I speak from my own experience. I have great colleagues who really appreciate our presence, particularly with the excessive pressure on everyone. Patients don't mind seeing us. As we all come, we introduce ourselves. At the beginning, it's a bit of, who are you?
You get that.
The moment you explain what you do and what is your role, they say, okay, that's fine. I'm happy for you to assess me, and I haven't had any complaint. Actually, there are very, very positive remarks, even from senior consultant management, and that shows by that, you know, the profession is very much appreciated, and it would explain why there are more and more universities that open to introduce this course. Back in early mid 2000, around 2008, we were like less than 1,000. I'm talking about 500 people.
Okay.
In 2003, we had maybe 30 PAs in the whole UK. Now we have almost 3,000 physician associates, and the numbers are growing. And with the fact that the GMC, which is the Council of Medicine, General Council of Medicine, I think it's called, they have now been appointed by the Department of Health and Social Care to regulate our profession.
Okay. Yeah. So that's really good for your profession, I guess.
It is indeed. It is indeed, because although there are ongoing talks, and then which the PAs, both the faculty physician association, which is our representatives, alongside us PAs who are, you know, members of this voluntary registrar, we have been involved in this talk to understand how best to regulate our profession, you know, in line with the current legislation, to ensure that patient safety, our own safety, is in line with what the current guidelines. So I think, from my understanding, hopefully in early or mid 2025, we'll be able to have all regulation settled.
Okay, that's really good.
Yeah.
Okay. And then, you know, when you said something about depending on, well, in hospitals, it might be a little bit different from GPs practices. How does it work in a GP practice then?
So in GP, it's a bit more. So GP is not easy job.
Right. Yeah.
There's a lot of things GP go every day. 6,000 patients per 1.2 GP.
Jeez.
So the pressure on them is quite a lot. So primary care require more support. Whereas in hospital, where you have more supervision, high numbers of doctors, seniors around in most of the situation around your 9 to 5 daytime, in GP you will be allocated to a supervisor, which will be a senior GP, who would ensure that the patient you're seeing, you know, are discussed day by day or cases by cases, in line with the, you know, the medical legislation, and then differently from hospital, whereby you need certain imaging requirement may be done alongside someone close to you. There may be some gap of delay in both arrangement, and it's more technical aspect than anything. So yeah, I think that's the major difference.
Okay, so is there any story that kind of reconfirms that this is definitely the profession that you want to continue in?
Any story?
Like there's a favorite story that you feel that reconfirms that this is the profession that you like to be in.
I think it's a perfect story. I think working cardiology, for instance, I remember this patient who had difficult narrowed blood vessels in the heart, and then required stenting, which is like opening the narrowed blood vessel in order to allow the normal circulation into the damaged side of the heart. And then he was Italian, so he couldn't properly understand what he's being diagnosed, how he's being investigated, managed as well. And being able to apply my knowledge and my background and my own second language to explain to him and make him feel more confident and reassured, that made me think, yes, you know, I love what I'm doing. Or whenever I kind of have a positive impact in the management, or if someone coming in sick and I leave in hospital back to the normal level. You know, it's kind of things that are quite rewarding. Seeing family thanking you, although you're not the only one responsible, but showing appreciation for the time you invested in their care. I think there's no alternative way that can pay that off. Does that make sense? And then that's the reason why most people join this type of profession. It's about providing a positive impact in someone's life, ensuring that this will be carried on as time goes on.
And you said your second language, Italian? Right. So how did that work?
So being raised in Italy.
You was raised in Italy.
I was born in Nigeria. And then moved at age 1.5 maybe 2 years with my mom.
Right.
So I grew up there and then moved to the UK in 2016. So I'm
Okay.
quite fluent in Italian and
Yeah,
English as
yeah,
well.
yeah. Oh, that's amazing.
Thank you.
All right. So what we're gonna do? We're gonna go to another part of the show. It's
Yeah.
called rapid fire. It's not rapid. It's just three questions. It's
Yeah.
either pick a choice
Hmm.
or a yes and no.
Yeah.
All right. So for our first question,
Yeah.
with the increasing pressures of the NHS,
Yeah.
do you feel that physicians associate
Yeah.
are outweighing doctors in surgeries?
No. The
Okay.
answer is no. We are not outweighing the numbers of doctors. We are aids to support doctors and the care needs of patients in community,
Mm.
which has been increasing, particularly after the pandemic.
Mm.
Our role again is mostly to care and support patients and then ensure that the excess workload is not falling to one person, which
Yeah,
is the GP.
yeah, yeah.
Again, there are yes bit of doubts about how we fit in this whole situation, but it's just a matter of give time.
Mm-hmm.
My dad always says, "Allow water to take its shape." You
Yeah,
know?
yeah, yeah.
So
yeah.
with time, the numbers of PAs in GP will be in a equal ratio to the numbers of doctors. So it won't be that there are more
Okay.
PAs rather than GP in a GP practice, but it will
Right.
be even. So that if a patient comes in, instead of waiting weeks for an appointment, you're able to see a physician associate. Which, however, as I said, we have a
Yeah.
medical knowledge.
Yeah.
We're trained in a medical way. So I'm not saying we are as good as doctors,
Yeah.
but our knowledge is as much as similar as what the doctors have.
Yeah.
So
yeah.
we are capable of sustaining and managing people with the most common presentation, which
Yeah.
allows doctors to be seeing more critical, unwell people in community that require much of a higher attention and higher knowledge of their own management. So being able to see the common condition, a cough, a flu, someone come with a chest pain, this the most common thing we see in GP. I think a PA is capable of doing that. Whereas people with a more unwell state, with cancer, rheumatologic condition, which require very, very detailed attention, then it's best for a senior person to be taking over that kind of care. So again, it's all matter of giving appropriate supervision, and then the physician associate will be will have a very positive impact in patient care.
So for our second question,
Yeah.
would you prefer to see a patient once for their care and treatment,
Yeah.
or would you like to follow up with them for a longer duration of time?
I prefer continuity care.
Okay.
Yeah. Being acute medicine, I also work alongside the frailty team, which is the elderly care patients, which are patients over the age of 6 to 70 who may require a higher needs of support at home.
Right.
So in hospital, you have short staying wards where they present with an acute illness and they're being triaged or treated within 24 to 48 hours,
Yeah.
and then referred to their specialties. When I was under the frailty team, which is geriatric medicine, I was in a long staying ward. So I had the opportunity to look after people, elderly people who required a longer attention in terms of your treatment management, which is nice because you kind of build rapport with them.
Yeah.
They know you, they know who you are. You explain what's happening.
Yeah.
You speak with the family. The family recognize who's looking after their next of kin, and then as being a continuity of care, your management isn't just focused on acute presentation, but you're playing a role on everyday basis, and you become the main responsible for that person, still under the supervision of a consultant, but then your own decision are taken into consideration as part of the long-term plan of that person. Obviously, being hospital, I don't follow them in community. That would be the role of a GP.
Yeah.
But patient may be readmitted again, and maybe somebody you have seen a month or 2 months ago.
Right.
So you already know the history. You already know what is their baseline, and you know what is their most required need in that current stage, which is useful and makes management much easier than an acutely unwell person that comes into hospital. Whereas if you have an acute unwell patient, it's good for your learning something new. It can be interesting.
Yeah.
It's just that moment. But I feel, but you don't build a rapport.
Right.
You just see that person. Maybe if you're in A&E or on take desk, you're seeing just for that moment.
Yeah.
Maybe you won't see them again, But having that continual care just builds up that rapport, and it's
Yeah.
a patient-focused care. You know,
Yeah.
the patient is there. You're looking at from every aspect of the needs,
Yeah.
mobility, medical aspect, and the social aspect from the family home support.
So for our last question,
Yeah,
as your job is physically and mentally demanding,
yeah.
what do you do to prepare yourself for this? Would it be outdoor activities, such as arts and galleries, or would it be a workout?
Okay. It's not easy. It's not easy. Working hospital or as well as working GP, you can be in training mentally and physically, particularly where there's a lot of pressure on yourself. You can experience burnout if you don't, take appropriate adjustment to ensure that your body and mind are in the right place. And if you don't do that, that will affect both you physically and also how you look after someone. Um, what I do is possibly going to the gym. That's one of the things I do.
Okay.
So after work, I head to the gym straight afterwards and work out. Either going on a treadmill, running 5 kilometers, and then jump into some machines to do some weightlifting. On the weekends, you might find me some exhibition, art exhibition. It's just a way for me to kind of be stress free, to
Right.
take a
Yeah.
breath
To
and then,
break.
does that make sense? Because we deal with a lot of things, and I don't speak just for physician associates, because any profession in the hospital field or in the general practice field, we see people dying. We have difficult conversation with families, which can be explaining to someone's family or to the patient, I'm very sorry, we have found out you got a tumor, or I'm very sorry your heart pump function is not great as it's supposed to be. And then, you can, try to understand what runs through that person's mind. There's a lot of questions runs through their mind. Oh, I've been diagnosed with X, Y, and Z diagnosis. How will this affect me? How will this affect my family? All this kind of thing. So you're trying to comfort that person. But in doing that, you're giving a lot of yourself. That's
Of
the
course.
empathy side.
Yeah.
And then as you give more of yourself over time, the empathy goes away. And that's when you need to step aside and say, wait, I need some time, I need to take a break.
So for you, is it working out, or is it artists activity?
It's mostly working out.
Working out. Okay.
For me,
fair enough.
I played football for many years. I did athleticism. I did marathons, half marathon. I wouldn't be able to do a marathon. I don't have those big lungs. But it's just the endorphins, the hormones is being released. You just coming up from the gym and having a shower afterwards. You just feel better. You physically be tired, but then that was a good workout. And that gives you strength to go to work the next day.
For final questions, where do you feel the healthcare will be without your profession?
I don't think there would have been major difference.
Okay.
In a way that the NHS have been present for decades.
Right.
Without the presence of PAs.
Right.
However, there would have been more of a higher pressure on the current numbers of doctors, nurses, and other allied health professionals. As we all know, the NHS is going through a difficult time currently, with a very high demand from the patient side, from the public also opinion. So us being there is kind of a way to support everyone, without taking anyone else's position. And then I think, our presence is much appreciated by everyone, our patient, colleagues, and I look forward to see how it will be the next 5-10 years.
Yeah. Do you see your profession progressing in any way? So I know you was mentioning in 2025 the GMC might allow you to have more independence in a sense.
Yeah.
But do you see yourself, or do you see your profession progressing in any way at all?
I think definitely. I don't see why in the first place.
Yeah.
I think once we have a statutory regulation and then legislation regarding our right to prescribe, that would grant us to be able to work in different aspects of medicine. We'll be having a better structured progression, which we don't have at the moment. who have opportunity to work in field that maybe they never worked before.
Yeah.
And then that will go all in the best interest of the NHS, the workforce, and the patients as well. In the States, they have physician associates who are working in GP practice, on GP practice, do surgery, you know. So a lot of things are coming up. Just a couple of months ago, weeks ago, they were introducing PAs being able to now attend courses to do endoscopy, which is something new. So I feel like as years goes by, there are higher and better recognition of our own presence in the NHS, which will give great opportunity for everyone to be involved. And then with better structure, there will be a better working environment without conflict of interest. And then, you know, you'll be able to be a pioneer on what you're doing, and then giving other people share your own experience so they can look, oh, I want to become that person in this specific field. Let me tell you how I did it. You know, let me tell you what I've gone through in order to become in that way. So all is down to giving us a structure, and then we'll be able to progress as time goes on.
So for a final question, do you think there's anything that's missing in your profession besides everything that you mentioned?
Oh, well, if there's anything that's missing.
Anything else?
I think, quite frankly, there isn't much really. I think the key things that we have been asking for years now is mostly the right to request ionized radiation and medication. But I think aside for those two things, I think the structure is fundamental. You know, when you compare to doctors that have a training program, when you have foundation year 1 doctor, foundation year 2 doctor, senior house officer, registrar, and then all the way to become a consultant. I think having such a structure, opportunity to be in a training program without having any negative impact on the ones of the doctors will give a lot of people, you know, the ambition to progress into a higher position. It wouldn't be just limited within just one specific aspect of your job. You're thinking about, okay, I could actually be responsible of other physician associate, or I could be involved in the teaching aspect of that, or I may become a senior, be involved more of a critically unwell patient. I think if that's present, a lot of people will be looking forward, or as the years goes by, this is what I want to do in years to come. And I think it's the thing that most people feel the most, to be honest, aside for the two elements I mentioned earlier. Just the structure. Having a structure makes everyone feeling a lot better.
I didn't even actually think about that as well. It's been amazing understanding the profession, something that I didn't know that much about, but now I'm more in tune of, how you really support not only the NHS, the GP, and the patients. So I really do appreciate the time that you spent sharing your knowledge and all the information that we've gathered today. So I really appreciate it.
Thank you
and
so much.
Is there any way of getting in contact with you, just in case people want to know more, or how to go about to get into the profession?
Sure. I have an Instagram page and a YouTube page as well. And then it's essentially called Heart Brave with the H. I have a unique name. Very hard for that. So, and then I'm happy to share the username with you afterwards. And then you can see some of the videos from my past profession as a sports therapist and my current profession as physician associate. And then one of the reasons why I come to this podcast is just to, give public opinion, make people understand what we do, who we are, and what are the future plans of our profession, as this will benefit a lot of people to understand what we're doing, and without causing confusion and clarifying things that maybe has been spread in the wrong way.
It's amazing, sir.
But it's been a very great honor for me to be around. It's just been a pleasure, and you have a wonderful set, and thank you so much for having me.
I really appreciate it, man. Thank you, and thank you all for joining.
Thank you.